If you're an older man who still masturbates, I need you to hear this because there's something almost no one talks about, something that could be quietly weakening your erections, dulling your sensitivity, and eroding your confidence. Not because you're doing it, but because of how you're doing it. My name is Dr. Mohit Khera, and for over 30 years, I've helped men over 60 reclaim their energy, intimacy, and strength. And this, what I'm about to share, is one of the most common yet least understood issues I see in my clinic every week. You see, most men believe masturbation is either good or bad, black or white, but the truth is far more nuanced and much more important than you might think, because while self-pleasure can support your health, it can also chip away at your performance, hormone balance, circulation, and even your emotional connection to others, if done the wrong way. That's why in this video, I'm going to walk you through the 10 hidden risks of masturbation after 60 that most doctors never explain. I'll also show you how to turn this private habit into a tool for protecting your prostate, improving blood flow, supporting testosterone, and deepening intimacy. And before we finish, I'll share a simple natural technique, just 7 seconds long, that I give my patients to restore firmness and desire safely, powerfully, and without prescriptions. But first, if you haven't subscribed yet, go ahead and tap that button and turn on notifications so you don't miss health insights designed specifically for men in their 60s and beyond. If this video speaks to you, type 1 in the comments. If not, type 0 point. Your feedback helps me tailor this content to serve you better. Now, let's talk about the risk most men never see coming, because it's not just physical, it starts much deeper. The first hidden risk of masturbation after 60 is social isolation. I've seen it slowly erode the emotional well-being of countless men, and yet no one warns you about it. I remember one of my patients, a retired high school teacher, 67 years old. He sat across from me with that quiet look in his eyes, the kind of heaviness that doesn't come from age, but from being unseen. After a few minutes of small talk, he leaned in and said, "Doc, I haven't touched another person in months, but I still take care of things on my own. Is that bad?" That question stuck with me. Not because of the act itself. There's nothing inherently wrong with self-pleasure. In fact, when done intentionally and with balance, it can be a healthy part of a man's sexual life. The problem is when masturbation becomes a replacement for intimacy rather than a support for it. Many men in their 60s, 70s, and even 80s slowly drift into routines of quiet solitude. A solo release becomes a source of comfort, a habit, a way to feel something, even for just a moment. And without realizing it, they stop seeking connection. They stop dating. They stop engaging emotionally, romantically, socially. Masturbation fills the gap until the gap becomes a canyon. But it's not just about sex. It's about slowly pulling away from life itself, from hugs, from laughter, from eye contact, from the simple feeling of being seen as a man, not just a patient or a pensioner. I've watched men lose the desire to touch, to reach out, to connect, simply because solo pleasure was easier than facing the vulnerability of real human closeness. Here's the hard truth most won't say out loud. Physical touch is more than pleasure. It's medicine. It keeps your emotional circuits alive, your testosterone levels engaged, and your sense of self-worth intact. When you stop reaching out, your world shrinks, not because you're older, but because you stop believing anyone still wants what you have to give. So, if you've noticed yourself turning inward more often, if your private life has become your only form of connection, please know this isn't failure. It's a signal, a reminder that you were wired for more. And more is still possible, no matter how long it's been. Rebuilding that connection doesn't mean diving into dating or chasing romance. Sometimes it begins with something simple: calling an old friend, joining a local group, talking to someone new. Intimacy isn't just physical, it's being seen, being heard, being human again. Because the moment we stop believing we deserve closeness is the moment we start settling for isolation disguised as independence. And while emotional disconnection is one danger, the next risk hits closer to the body itself, something most men are damaging without even realizing it. Let me show you what that is and how to avoid it. ChatGPT said, risk number 2 is something few men ever talk about: skin micro-lesions. Not long ago, a man in his early 70s came into my clinic. He was clearly uncomfortable, hesitating before finally saying, "Doc, I've noticed some irritation down there after you know, and it's happening more often lately." I could hear the worry in his voice, but also a quiet shame, like this was something he should have outgrown by now. But here's the truth: the skin of the penis becomes thinner, more delicate, and slower to heal as we age. We lose collagen and elasticity, and when you combine that with decades of friction, it's no surprise that many older men develop what we call micro-lesions: tiny tears or abrasions in the skin that occur during masturbation, especially when it's too rough or done without proper lubrication. Most men don't notice these injuries at first: just a little redness, a sting, maybe some mild sensitivity that fades. But over time, these repeated micro-injuries can lead to inflammation, irritation, and even scarring. Ironically, instead of increasing pleasure, they actually reduce sensitivity. And in worse cases, they become an open invitation for bacterial or fungal infections, especially in warm, moist areas where those organisms thrive. The worst part? Many men assume that the discomfort means there's something wrong with their hormones, their nerves, or their age, when in reality, it's often just their technique that needs to change. Masturbation should never hurt. If it does, that's not a sign of weakness. It's a signal that your approach needs to evolve. So, what can you do? First, be gentle. You're not 25 anymore, and that's not a limitation. It's an invitation to treat your body with greater respect and care. Second, always use a high-quality water-based lubricant. Don't rely on petroleum jelly or spit. Those do more harm than good. A proper lubricant reduces friction, prevents tearing, and helps preserve sensitivity over time. Third, slow down. You're not racing the clock. This is about connection, not just completion. I often tell my patients this stage of life isn't about less pleasure, it's about better, wiser pleasure. Pleasure that respects your body and honors the years behind it. There's absolutely nothing shameful about adjusting how you touch yourself. In fact, it's powerful. It means you're learning to work with your body, not against it. And that's what real masculinity looks like at this age. Not avoidance, but awareness. But while friction and irritation are warning signs you can feel, what about the risks you can't? What if the real damage isn't happening in your skin, but in your brain? Risk number 3 is desensitization. He was 64, smart, healthy, still working part-time, and yet he sat across from me, looking completely defeated. "Doc," he said, "I can't feel anything like I used to. I can still get there on my own, but with my wife, it's different. I don't know what's wrong with me." I see this far more often than most men think, and in many cases, it's not about testosterone or circulation. It's about something I call quiet conditioning, a neurological pattern that builds up over time. When a man masturbates the same way, with the same grip, the same rhythm, the same fantasy, or screen, his brain and body begin to associate pleasure with that one specific pattern. It's like carving a deep trench in the ground. Every time you pour water, it follows the same path. Eventually, it forgets how to flow anywhere else. That's what desensitization looks like. For men over 60, it often shows up as difficulty becoming aroused with a partner, needing more and more stimulation just to feel anything, or struggling to climax unless a very specific solo formula is recreated. What once felt natural now feels like effort, and that creates confusion, frustration, even shame. But it's not a failure. It's not even a medical condition. It's neurological conditioning. And the good news is, it can be reversed. The first step, change the way you touch yourself. Vary your speed. Switch your grip. Explore different positions. Try using your imagination instead of relying on a screen or fantasy every time. And most importantly, slow down. Stop rushing toward release and let yourself explore. Variety and mindfulness are the antidotes to numbness. When you reintroduce novelty, you reawaken sensitivity, not just in the body, but in the brain. And here's something I tell every man who sits across from me feeling like he's broken. You're not. Your nervous system isn't damaged. It's just been overtrained in one direction. What it needs is not guilt or shame. It needs patience, permission, and time to reset. I've seen men rekindle intimacy with their partners, even after years of disconnection, simply by changing how they practice. You can too. They didn't need pills. They didn't need surgery. What they really needed was something far simpler: permission. Permission to slow down, to explore their own bodies with curiosity instead of urgency. Because this next risk is subtle, and that's exactly what makes it dangerous. You may not even realize it's happening until the emotional distance between you and your partner feels too wide to cross. But that bridge can be rebuilt, and it starts by retraining how your body and mind respond to pleasure, both alone and in connection with someone else. Now, if desensitization changes how your body feels pleasure, the next risk goes even deeper because it can hide something life-threatening. It's one of the most overlooked issues among older men, and often it goes unnoticed until it's too late. Risk number 4, masking erectile dysfunction. I once met a man in his late 60s who finally came in after avoiding the issue for nearly a year. Outwardly, he looked healthy. He exercised regularly, had been married for decades, and on the surface, things seemed fine. But after a little conversation, he quietly admitted, "I can get hard when I'm alone, Doc. But with my wife, it just doesn't happen anymore. So I stopped trying." That moment was heavy. Not because he was broken, but because he didn't realize his body had been sending him a warning. What he thought was just a minor bedroom issue was actually the first symptom of something much deeper, possibly vascular disease, blood sugar imbalance, or hormonal decline. Here's what most men don't know, and what many doctors fail to explain. The penis is one of the body's most sensitive indicators of cardiovascular health. When blood flow begins to slow, when arteries stiffen, when testosterone drops, or nerves start misfiring, the very first place many men notice changes is in their ability to maintain a firm erection, especially with a partner. But because masturbation is often easier, mentally, emotionally, and physically, many men assume they're still functioning just fine. They're still able to get aroused solo, so everything must be okay, right? Not necessarily. Solo arousal doesn't require the same psychological complexity, emotional vulnerability, or full body engagement as partnered intimacy. And that means solo performance can mask early signs of erectile dysfunction. It can give the illusion of health while the underlying causes, whether it's heart disease, diabetes, or testosterone decline, continue to progress quietly. But all of these are highly treatable when caught early. I always tell my patients, I'd rather see you sooner with a small concern than later with a serious problem. When we catch these issues early, we can restore circulation, rebalance hormones, and even reverse many causes of ED without drugs or surgery. So here's what I want every man over 60 to understand: there's no shame in needing help. What's dangerous is ignoring the signs. If you're noticing changes, softer erections, less stamina, difficulty with a partner but not alone, don't dismiss it. Talk to a physician who sees you as more than just a symptom. You deserve a full, connected, healthy life, not one that quietly settles for workarounds. Now, if that risk hides in your blood vessels and hormone levels, the next one might surprise you even more, because it doesn't come from something inside your body, but from something as ordinary as the way you sit. Risk number 5: nerve compression from poor posture. A few years ago, a man in his early 70s came to see me. His concern? A dull, creeping numbness in his groin that had been worsening for 6 months. At first, he thought it was poor circulation or just a normal part of aging. But after a detailed evaluation, I discovered it wasn't vascular at all. It was neurological. And the culprit? His posture. Many older men spend a lot of time seated: recliners, office chairs, hunched over in quiet privacy. And while that may seem harmless, sitting for long periods, especially on hard surfaces or in a slouched position, can compress the pudendal nerve, the nerve responsible for sensation in the penis, perineum, and pelvic floor. Over time, this pressure can lead to numbness, tingling, decreased sensitivity, and even pain during or after sexual activity. It usually starts subtly, maybe a slight dullness or a buzzing sensation that's easy to dismiss. But if left unaddressed, this nerve compression can become chronic and much harder to treat. The frustrating part is that most men think the issue lies in their libido or hormone levels, when in fact, it's a simple mechanical problem. The good news? It's easy to correct once you're aware of it. Start by adjusting your posture. Avoid masturbating while sitting on hard chairs or slouching forward. Instead, choose a reclined or lying down position with proper support for your spine and pelvis. A pillow under your knees can help relieve pressure on the lower back and open up the pelvic region. Throughout the day, take breaks from sitting. Stand, stretch, walk around. Your nerves need movement just as much as your muscles do. I often remind my patients, comfort isn't a luxury, it's a form of protection. The way you position your body, especially during private moments, reflects how seriously you take your long-term health. When you give your nerves space to breathe, you give your body permission to feel again. It may seem like a small adjustment, but these small things matter. Because when you start feeling numb in places where you once felt alive, the answer might not be in a pill, but in a pillow. It's not just physical. It touches your sense of masculinity, your confidence, and your connection to yourself. While posture can quietly influence sensation, the next risk dives into something even more subtle, something many men turn to in moments of stress, loneliness, or emotional fatigue. At first, it may feel harmless, even helpful, but over time, it can become a quiet emotional trap. So let's talk about what happens when masturbation stops being just physical and starts becoming your only form of emotional escape. Risk number 6: using masturbation as your only emotional outlet. I once sat across from a man in his late 60s who, almost as an afterthought, said, "Some days I just get tired of feeling things. Masturbation helps me shut it off." He wasn't talking about lust. He was talking about loneliness, stress, boredom, that dull, heavy ache that builds when no one calls, when every day starts to feel the same, and silence becomes your closest companion. And I understood, because for many older men, especially those who are retired, widowed, or living alone, masturbation becomes more than a release. It becomes a form of emotional regulation, a way to cope with feelings that feel too heavy to carry. In these moments, you're not really chasing pleasure. You're chasing relief. You're trying to quiet the noise in your chest. And the truth is, self pleasure can help. For a moment, it lowers cortisol, releases dopamine, oxytocin, and prolactin, chemicals that create a temporary sense of calm, safety, even connection. But when it becomes your only outlet, it shifts. It becomes avoidance. Instead of facing grief, sadness, restlessness, or emotional pain, you numb them. And slowly, what started as comfort becomes dependence. You might not notice it at first. Maybe you skip a social outing, ignore a phone call, or lose interest in a hobby you once loved. Not because you're depressed, but because it's just easier to stay home and seek that familiar, controllable comfort. But over time, your world gets smaller, and your capacity for real emotional engagement shrinks with it. Let me be clear, there is no shame in needing comfort. Every man at every age needs ways to manage emotional pain. But if masturbation is the only tool you're using, it may be time to expand your emotional toolkit. Start small. Talk to someone, a friend, a counselor, a support group. Move your body, go outside, build routines that involve more than solitude. Choose actions that reconnect you to the world rather than distract you from it. Because as good as orgasm might feel, it's no substitute for purpose, for conversation, for a sense of being part of something larger than yourself. You deserve a life that offers more than momentary escape. You deserve emotional strength, and strength doesn't mean bottling everything up. True strength is the ability to feel, to stay open, and to choose how you respond. That kind of masculinity, rooted in awareness, not avoidance, is powerful. But while emotional escape can slowly drain your spirit, the next risk is one that weighs even heavier, not just on the heart, but on your identity. Risk number 7, guilt and shame. He was 72, a retired pastor, gentle, soft spoken, and deeply thoughtful. When we began discussing his sexual health, his eyes lowered. His voice went quiet, and then he said, "Doc, I still do it sometimes. And afterward, I feel like I've done something wrong. I can't even look at myself in the mirror." That kind of quiet shame runs deeper than most people realize. It's often not about the act itself, but about what you were taught to believe about it. For many men of an older generation, especially those raised in religious or deeply traditional homes, masturbation wasn't seen as a normal part of human experience. It was framed as sinful, weak, perverse, and those messages don't just fade with time, they settle into the body, into the self-image. So even now, decades later, I meet men who carry guilt like a shadow. They never talk about it, not with friends, not with doctors, and they've never questioned whether that guilt is even valid. Instead, it festers. And every time they touch themselves, they feel a moment of comfort followed by hours or even days of quiet punishment, not because it harms their body, but because it wounds their sense of self. Here's what I want you to hear clearly. There is nothing shameful about tending to your own body. There is nothing immoral about seeking comfort, pleasure, or closeness, especially later in life when intimacy can be harder to find, but no less needed. Masturbation, when done with care and awareness, is a valid way of caring for your physical and emotional health. It's not a flaw. It's not a failure. It's human. But if you've carried guilt for years, even silently, it can have real consequences. Chronic shame can increase cortisol, suppress your nervous system, and dull your body's ability to feel pleasure. It erodes confidence, clouds relationships, and makes you feel unworthy of the very things your body and heart were meant to experience: touch, joy, connection. So, what's the first step toward healing? It's not changing what you do, it's changing what you believe about what you do. That may mean speaking with a therapist, especially one trained in sex positive, age informed care. Or it might mean rewriting your own inner dialogue, replacing judgment with compassion, swapping guilt for gratitude. You're not broken, you're not dirty, you're a man with needs, desires, and a story. And you have the right to hold all of it with dignity. Because while guilt can weigh heavy on your heart, the next risk we're about to explore weighs even heavier, dragging down your body, your energy, and your drive. And it all starts with something you thought was harmless. Too much of a good thing. It starts as a subtle ache, not sharp, not overwhelming, just a quiet physical heaviness that builds over time, until one day it's impossible to ignore. For many men, this discomfort is their body's way of whispering, I need rest. Risk number 8, pelvic congestion. Not long ago, a man in his late 60s visited my office with a strange complaint. Doc, he said, I don't know how to describe it exactly, but there's this dull, heavy ache down there. It's not pain, really, just pressure, constant. He'd already ruled out infection. His prostate exam came back normal. But when I asked about his habits, specifically how often he was ejaculating, his answer said everything. Since retirement, he said his days had become quieter, more unstructured, and to cope with boredom and stress, he'd started masturbating more often, not once in a while, 2, sometimes 3 times a day. It helps me sleep, he said. It gives me something to do. But lately, I just don't feel right. What he was experiencing is something called pelvic congestion, a buildup of blood and pressure in the pelvic region caused by repeated stimulation without enough recovery time. Frequent ejaculation, especially over long periods, can irritate the blood vessels and tissues in the pelvic floor. The result? Heaviness in the testicles, aching behind the pubic bone, soreness that lingers without any clear cause. This isn't a question of morality, it's a matter of balance. As we age, our bodies need longer recovery windows. The systems that once snapped back quickly, blood flow, hormone signaling, muscular response, now require more patience and care. That doesn't mean you're fragile. It means you're wiser, and wisdom means learning to listen. If you're feeling that dull pelvic heaviness, or even fatigue or tension after frequent masturbation, it's your body's way of asking for moderation. Most men over 60 do best with a few days of rest between sessions, not because frequency is bad, but because recovery is just as vital as activity. And pleasure doesn't grow with repetition. In fact, when you give your body space to reset, sensations often come back stronger, more vivid, and more satisfying. So, no, you don't have to live with that dull ache. You don't need to push through the discomfort or ignore what your body is quietly trying to say. Sometimes all it takes is adjusting your rhythm, and the difference can be felt not just physically, but emotionally and sexually as well. Now, while pelvic congestion is a sign your body sends from below, the next risk we'll explore begins deep on the cellular level, and it's especially important if fatherhood is still part of your story, or even something you haven't completely ruled out. Risk number 9, potential impact on semen quality. He was 61 and newly remarried. When he walked into my office, I could feel his quiet hope. My wife and I are trying for a baby, he said. She's younger and we're hopeful, but it's been 6 months and nothing. He wasn't panicked. Not yet. But there was pressure there. After reviewing his labs, everything looked decent. His hormone levels, overall health, all within normal range. But when I asked about how often he was ejaculating, he paused. Pretty often, he admitted. Every day, sometimes more. It helps me relax. I figured the more, the better. Right? It's a common belief, but it doesn't always align with biology. While frequent ejaculation isn't harmful in most cases, it can reduce semen quality in the short term, specifically sperm concentration. Your body might be producing sperm, yes, but if you don't give it enough time to replenish, the overall quality of each sample can suffer. And for men in their 60s and beyond, where sperm production naturally slows, that recovery window becomes even more important. This doesn't mean daily ejaculation will destroy your fertility, but if you and your partner are actively trying to conceive, strategy matters. Research shows that waiting 2 to 5 days between ejaculations can significantly improve both sperm concentration and motility, the two key factors in male fertility. It's not about abstaining forever. It's about giving your body the time it needs to build quality. Fertility isn't just about desire, it's about timing, biology, and being intentional with your habits. So, if fatherhood is still something you hope for, or even if you just want to preserve the possibility, adjust your rhythm. Let your body rebuild what it needs to offer its best. Because your ability to create life isn't just physical, it's emotional, even symbolic. It's proof that your vitality, your energy, your capacity is still alive and strong. And while that risk matters most for those considering family, the final one we'll talk about today affects every man, no matter your age, no matter your goals. Because this one starts in the mind, and if you're not careful, it can quietly change how you see women, intimacy, and even yourself. Risk number 10, disconnection from reality. I once had a deeply honest conversation with a man in his early 70s. He leaned forward, lowered his voice, and said, "It's not that I don't want intimacy with a partner, Doc. It's that real life just doesn't do it for me anymore. I don't know when it happened, but I stopped feeling excited by actual connection." That hit hard because it's something I see more often than you might think. When masturbation becomes tied exclusively to fantasy, especially when it's reinforced by digital content, screens, and repetitive scenarios, the brain begins to rewire. It starts craving what's not real. And slowly, genuine moments of intimacy with a partner, touch, eye contact, scent, conversation, feel dull by comparison. The brain becomes overstimulated by novelty and underwhelmed by reality. This kind of disconnection doesn't happen overnight. It creeps in slowly. First, maybe it takes more stimulation to get aroused. Then, maybe you lose interest in being touched or holding someone close. Eventually, your body may still respond, but your heart, your mind, your spirit disconnect. This is why it's so important to reconnect with realness, with slowness, with imperfection, with the beauty of being seen by another human being in the moment. It means reducing screen-based stimulation, engaging your imagination, creating space for real-world intimacy, whether emotional or physical, to feel fulfilling again. Because at the end of the day, intimacy isn't just about climax. It's about connection, about presence, about vulnerability. When you can bring that back into your relationship with yourself and with others, you don't just heal your body. You restore something far more meaningful, your capacity to love, to connect, to feel fully again. And that, at any age, is what true masculine strength looks like. That moment stuck with me, not because the man sitting across from me was struggling with erectile dysfunction or low testosterone. No, it was something more elusive, and in many ways, more damaging. He had unknowingly trained his brain to respond only to fantasy, to the hyper-curated, intense stimulation of pornography. And over time, real life connection, touch, scent, voice, emotion just couldn't compete. You see, the human brain, especially the male brain, is incredibly sensitive to novelty. When it's repeatedly exposed to exaggerated, unrealistic content, the reward system begins to shift. The brain starts craving the extreme, the dramatic, the impossible, and in the process, it becomes less responsive to what's natural, the subtle, the genuine, the human. These begin to feel dull. For men over 60, this risk becomes even more real. Life often slows down, loneliness becomes more common, and the allure of escaping into a digital world grows stronger. There's no shame in that, only understanding. Screens don't judge, they don't require vulnerability. They offer guaranteed stimulation, on demand. But what they quietly take is far more costly. Your sensitivity, your presence, your ability to feel moved by something or someone real. What may start as simple visual aid can grow into dependency. It may make it hard to be fully present, not just sexually, but emotionally. You may find yourself distracted during real moments that used to bring joy, or comparing your partner, even unconsciously, to images that were never real to begin with. But here's the good news. This kind of disconnection can be reversed. The brain is plastic. It can change. It wants to reconnect. You can retrain it. Start by taking intentional breaks from artificial content. Instead of instant visuals, engage your imagination. Tap into memory. Reflect. Let desire build without needing it to be satisfied right away. Explore the slower, deeper layers of intimacy, and when possible, seek real human connection, no matter how small. You don't have to be stuck behind a screen. You're not too old to feel something real again. Often, the richest form of arousal doesn't come from what you see, but from what you remember, what you feel, what you hope to experience again. And now that we've explored these 10 hidden risks, physical, emotional, hormonal, and neurological, there's one last thing you need to hear, because understanding the risks is only half the solution. What if there were a simple, natural way, a method that takes just 7 seconds a day, that could begin to reverse the damage, restore blood flow, and reignite the vitality you thought was gone forever? That's exactly what I want to share with you next. Conclusion? So now you know, masturbation after 60 isn't good or bad. It isn't black or white. It's a tool. And like any tool, the value depends on how you use it. We've explored 10 real risks, from emotional isolation and desensitization to nerve damage, pelvic pressure, guilt, and even a loss of connection to reality. Not to scare you, but to awaken something deeper, to give you permission to take better care of yourself. Because this stage of life isn't about giving things up, it's about doing them better, with more awareness, more care, more wisdom. Your body still responds, your desire still matters. And with just a few intentional changes, even your most private habits can become a source of strength, confidence, and renewal instead of confusion, discomfort, or shame. If any part of this message resonated with you, stay with me, because what I'll share next is the exact 7-second method I've taught hundreds of men. And for many, it's been the spark that reignited their energy, their confidence, and their intimacy, often within days. Let's talk about it.